Hello viewers, I am Dr. Rahul Reddy from Androcare Andrology Institute. Today we will be discussing about Azoospermia. Azoospermia means zero sperm count. So people who are trying for kids, generally from female sides, gynecologists will do scans and hormonal evaluation. But male point of view, generally semen analysis is the first test we do for fertility evaluation. So here, if in some patients, if there is zero sperm count, the report comes as azoospermia, because azoospermia means zero sperm count. So now what has to be done? So when there is azoospermia, people get panic because suddenly if they hear that there is no sperm count, they don't know what to do. Generally they rush to the clinics and they'll have a lot of doubt, anxiety. Most of these couples with severe anxiety, they keep firing questions to the doctor. So now whenever there is azoospermia, first thing we have to know is there are two types of azoospermia. One is obstructive azoospermia, second is non-obstructive azoospermia. So now what is obstructive azoospermia? So first thing what you have to know is sperm production happens in the testicles. So if in the testis, but if there is blockage in the sperm tube, then we'll call it as obstructive azoospermia. So here at least they are one way they are safe, because whenever we want children, we can put a needle into the testis, we can take sperms and we can do IVF. Or else if they want multiple children, we can actually do a surgery to clear the blockage, and then they can have children naturally. But problem is with non-obstructive azoospermia patients. Non-obstructive azoospermia patients, again there are so many causes. There are again two different types of non-obstructive azoospermia patients. Initially there was some production, and later because of some problem the production has come down. This is one kind of issue. And second kind of issue is by birth there is no sperm production. So now we have to see these two things. So now for some people where parents they have consanguineous marriage, their children are born with small testes, or some children they have Y chromosome microdeletions. These are the various genetic types: karyotyping abnormalities, Klinefelter syndrome, Down syndrome. For some people, CFTR gene mutations. So these kind of patients, they have these are called genetic issues. So most commonly asked question is, doctor, there is no genetic problem in my family. Why I got this? So genetic problems may not run in families continuously. These people, see, you may be the first person to have this kind of problem in your family, because gene slowly it gets altered over the time, and once there is gross variation or when there is Y chromosome microdeletions, then it can lead to Y chromosome non-obstructive azoospermia. There are, as I said, there are two types of non-obstructive azoospermia. One is previously there is normal spermatogenesis. Infections in the testis, we call it as epididymoarthritis. Generally, suddenly testis becomes big, patients will have severe pain, and after that the function of the testis will stop. That is secondary to infection. Sometimes because of radiation exposure, sometimes because of viral infections like childhood infections like mumps, or even recent days with COVID infection in the testis, and production is stopped because of the COVID infection. So after this, suddenly production stops. So now in these patients, generally what we do is we generally do a procedure called TSA, which is called testicular sperm aspiration. And if sperm is there, immediately we have to freeze the sperm and we have to go for the IVF procedure. So now there are various procedures for sperm retrieval in non-obstructive azoospermia. In obstructive azoospermia, it's very simple. Just put a needle, TSA procedure, once you do a TSA procedure, you get enough sperms which are enough for IVF. You can do n number of TSA n number of times. Every time you want to go for IVF, you can put a needle and take sperms. So regarding non-obstructive azoospermia, there are various procedures. I will try to explain them in next video. Okay viewers, goodbye. Thanks for watching.